Did you know your joints can feel decades younger just by changing a few simple habits? Many people over 50 think joint pain is inevitable, but science shows you can reduce pain naturally. Your joints are like hinges on a door, and if they are rusty or not well lubricated, movement becomes painful. One of the easiest ways to improve joint health is through low-impact exercise, such as walking, swimming, or cycling. Studies show that 30 minutes of gentle exercise 5 times a week can increase synovial fluid, which lubricates joints. Strengthening muscles around your joints reduces strain, so simple resistance exercises with light weights or elastic bands are highly effective. Flexibility matters too, so daily stretching routines like yoga or Tai Chi can maintain joint mobility. Many elders neglect posture, but sitting and standing correctly relieves pressure on knees and hips. If you are sitting for long periods, stand up every hour and gently stretch your legs and back. Overweight adults have more joint pain, especially in weight-bearing joints like knees and hips. Even losing 5 to 10 pounds can significantly reduce pressure on these joints. Nutrition plays a huge role, so include omega-3 fatty acids from fish, flax seeds, or walnuts to reduce inflammation. Turmeric and ginger have natural anti-inflammatory compounds that can ease joint stiffness. Vitamin D and calcium are critical for bone strength, which supports joint function. Sunlight, fortified milk, or supplements can maintain adequate vitamin D levels for adults over 50. Hydration is often overlooked, but water keeps cartilage soft and reduces friction in joints. Aim for 6 to 8 glasses of water a day and notice how your joints respond. Heat and cold therapy are powerful tools. A warm shower or heating pad relaxes stiff muscles. Cold packs can reduce swelling after exercise or a long walk. Regularly massaging your joints with gentle circular movements improves blood flow. Avoid repetitive stress on the same joint, for example, kneeling for long periods or carrying heavy loads on one side. Sleep quality affects joint repair, as growth hormone released during deep sleep helps regenerate cartilage. Aim for 7 to 9 hours of quality sleep every night to support joint recovery. Footwear is often ignored. Cushioned shoes reduce impact on knees and hips while walking. Orthotic insoles can correct posture and prevent uneven stress on joints. If stairs hurt your knees, try alternating steps or holding a railing for support. Simple bodyweight exercises like wall sits or seated leg lifts strengthen muscles around painful joints. Balance exercises such as standing on one foot or heel-to-toe walking reduce the risk of falls that can worsen joint pain. Tai Chi has been shown to improve balance and reduce knee pain in older adults. Mind-body approaches like meditation can reduce the perception of pain, as stress amplifies discomfort. Chronic inflammation contributes to joint pain, so reducing sugar, refined carbs, and processed foods can help. Foods rich in antioxidants, like berries, leafy greens, and nuts, counter inflammation naturally. Regular gentle movement prevents stiffness, so avoid sitting in one position for too long. Even small activities like gardening, light housework, or walking your dog keep joints active. Strengthening your core muscles stabilizes the spine and relieves pressure on hips and knees. Planks, seated abdominal twists, and gentle Pilates movements are safe for older adults. If one joint hurts more than others, start with low-intensity exercises and gradually increase. Warm up before exercise with light stretching or a few minutes of walking. Cool down after exercise to prevent stiffness and improve recovery. Hydrotherapy, or exercising in water, reduces impact on joints while maintaining strength. Swimming or water aerobics are excellent for elders with knee, hip, or shoulder pain. Compression sleeves or braces can give temporary support during activity, but avoid relying on them long-term as they may weaken muscles. Massage therapy stimulates circulation and helps maintain joint function. Consider gentle professional massage or self-massage with a foam roller. Maintain a regular schedule for exercise, stretching, and hydration to see consistent results. Avoid extreme positions or overstretching, which can injure fragile joints. Incorporate anti-inflammatory herbs like cinnamon and garlic into meals. These herbs not only improve joint health but also support heart and overall health. Strengthening your back muscles reduces strain on hips and knees, preventing secondary joint pain. Simple exercises like seated rows with resistance band are effective and safe. Walking on even surfaces reduces the risk of tripping and hurting joints. When climbing stairs, use handrails and step 1 foot at a time to reduce knee strain. Yoga poses like cat-cow, downward dog, and child's pose gently mobilize multiple joints. Avoid sudden twisting movements that can damage cartilage. Gradual warm-ups and slow movements protect joints during exercise. Consider swimming or water walking if you have arthritis in weight-bearing joints. The water supports your body and allows full range of motion with minimal pain. Deep breathing exercises reduce muscle tension and improve oxygen flow to joints. Include a variety of exercises to strengthen legs, arms, back, and core for overall support. Keep track of activities and pain levels in a journal to identify triggers and progress. Balance training reduces falls and injuries that could worsen joint pain. Daily short walks, even 5 to 10 minutes, maintain joint lubrication and mobility. Use chairs with proper support to reduce hip and back strain. Avoid crossing legs for long periods, which can misalign hips and knees. Check your body alignment in mirrors or with feedback from a trainer or physiotherapist. Strengthen upper body muscles to reduce shoulder, elbow, and wrist joint strain. Push-ups against a wall or light resistance exercises with bands are effective. Avoid long periods of repetitive tasks that stress the same joints. Break tasks into shorter intervals with stretches in between. Consistency matters more than intensity. Daily, moderate activity beats occasional high-intensity workouts. Consider gentle cycling to strengthen knees without excessive impact. Foam rolling or stretching before bed helps reduce morning stiffness. Warm baths with Epsom salts can relax muscles and support joint comfort. Stay socially active. Community walks, yoga classes, or dance groups encourage movement and consistency. Listen to your body. Mild discomfort is normal, but sharp pain signals to stop and rest. Maintaining a healthy weight is one of the most effective ways to prevent and reduce joint pain. Combine exercise with balanced nutrition for maximum benefit. Increase intake of high-fiber foods to control inflammation and maintain gut health. Gut health influences systemic inflammation, which affects joint pain. Vitamin C from fruits like oranges and kiwis supports collagen formation and cartilage. Magnesium-rich foods like spinach, nuts, and seeds help muscle relaxation and joint comfort. Limit alcohol as it increases inflammation and dehydrates joints. Quit smoking. Tobacco damages cartilage and increases arthritis risk. Practice mindfulness and stress reduction techniques, as stress worsens pain perception. If you feel stiffness in the morning, do gentle stretches before getting out of bed. Use supportive furniture like ergonomic chairs and mattresses for joint-friendly posture. Take micro breaks throughout the day to move and stretch joints. Include functional exercises that mimic daily tasks to improve real-life joint strength. Use household items like chairs or water bottles for safe resistance training. Avoid overexertion. Gradual progression in exercise intensity is safest for elders. Stay consistent with anti-inflammatory nutrition and hydration. Consider consulting a physiotherapist for personalized exercises. Group exercise programs for older adults improve motivation and adherence. Wear appropriate shoes for every activity, not just casual walking. Monitor joint pain and swelling, adjusting activity as needed. Gentle massage or self-massage with oil supports circulation and joint lubrication. Even light activity like standing while talking or doing dishes keeps joints active. Track your improvements to stay motivated and observe what reduces pain. Combine exercise, nutrition, hydration, sleep, and posture for the best long-term joint health. Remember that prevention is easier than fixing damage, so daily habits matter. By following these strategies consistently, elders over 50 can stop or significantly reduce joint pain without any medication. Movement, nutrition, hydration, posture, sleep, and gentle therapy work together to maintain healthy, pain-free joints. You are never too old to start, and small changes now can prevent serious joint problems later.